Thank you for joining us today for Cape Chronicle. I'm Audra Kane. With disasters like the recent tornado in Perry County, community agencies are here to respond quickly, and Catholic Charities of Southern Missouri Regional Director Kyle Schott will explain their programs and services. The Community Caring Council has a new director, Melissa Stickel, and we will be getting to know her and the social service needs in our area. The final segment of our show will wrap up with Cape Girardeau County Public Health Center Director Jane Wernsman and the health educator Liz House to review contagious and chronic diseases and more. That's all ahead on Cape Chronicle.
Whether it's for business or just a getaway, Cape Air is your wings in the Midwest. Cape Air serves 6 destinations, including Kirksville, Quincy, Fort Leonard Wood, Cape Girardeau, Marion, and Owensboro. Fly from Cape Girardeau to St. Louis with fares starting at just $49 each way. With easy connections through Lambert St. Louis International Airport, Cape Air connects you to the Midwest and the world. Book today at capeair.com or call 800-CAPE-AIR and enjoy the ride.
Welcome to Cape Chronicle. I'm Audra Kane. First responders are there when disasters and emergencies occur, and organizations like Catholic Charities come in to help pick up the pieces. Southern Missouri Regional Director Kyle Schott has more details. Thank you for coming, Kyle.
Thank you, Audra.
Well, after the recent tornado in Perry County, Catholic Charities was able to come in and help out for people who may have lost everything. How did you do that?
Well, what we have here in our region is what we call regional COAD, and COAD stands for Community Organizations Active in Disaster. And I chair our local COAD, which consists of 4 counties, Cape, Bolinger, Perry, and Scott counties. So in times of disaster, our first responders are always there. Red Cross comes in immediately, as well as the Salvation Army. And the COAD are different community organizations. Some of them are statewide, some of them are even national organizations will respond in that very early recovery stage. So we're not out there digging through the rubble like first responders are. We're coming in and we're helping pick up the pieces in the aftermath. So with the COAD, we have quarterly meetings, and our meetings mostly consist of everybody coming together so that we know who our partners are. So, for instance, when the Perryville tornado hit, the emergency management director, Hank Volker, was calling me the next day and said, "You're coming, right?" And I said, "Well, of course I'm coming. Let me get dressed." And
he's with the county,
and
right?
He's with the Perry County. He's the Perry County Emergency Management Director, so that we could come together to start to provide the services to people. You had in Perryville in Perry County, where this tornado hit, you had some 40 to 50 homes completely destroyed, and up to 150 that were affected by the tornado. So maybe it touched 500 lives, something like that. So we bring our services in, and some of those immediate services we partnered with Catholic Charities of St. Louis, because they actually cover the Perry County area, and I'm there in a capacity to serve as the COAD chair to assist bringing everybody together. So a lot of times it's financial resources early on. A lot of times it's feeding early on. Salvation Army fed and arranged meals for some 5,000 meals through that early part of that recovery effort. I know that Red Cross was there early on. We processed, meaning we as not just as Catholic Charities, but as a organization, a group organization with the assistance of AmeriCorps, over 3,000 volunteers. So, and now they have some 7 warehouses full of donated goods.
Oh my goodness.
Yeah, they have some 32,000 tubes of toothpaste. So for a town of 9,000 people and only 500 affected, you learn that donation management and volunteer management can be very critical. But because we have these partner organizations that we're aware of that specialize in these things, they don't become another disaster.
Right. And so just to alleviate some confusion that some people have, you don't have to be Catholic for Catholic Charities
Oh,
to
absolutely
assist.
not. We serve anybody and everybody. We do not proselytize. That's against our organization's code, and it's against Catholic Charities of USA. It's code. We don't try to convert anybody. We don't preach anybody. Catholic is who we are. It's not who we serve.
That's great. Now, I'm curious about those 7,000 tubes of toothpaste and the, is that how many you said?
32,000.
32,000 tubes of toothpaste. So what happens to the excess of items that have been donated for a disaster like that?
You know, every community is different, and how they choose to deal with their donated goods will depend upon what the needs of the county are. So in Perry County, what they've done is they've opened a storefront in Perry Plaza that is servicing only individuals affected by the tornado. Okay. So they know who those individuals are because they have a Red Cross case management number.
Okay.
They'll come in, and basically, for lack of a better way of putting it, it's the donated goods are free to them.
Okay.
So they can come in and get the donated goods that they may need to help them so that they can utilize other assets in other ways. So they've spread the rest of the goods out among many warehouses in the county, and then as they need to replenish the storefront, they'll replenish the storefront. In the end, they're going to have way more goods than they'll ever be able to utilize.
Okay.
But it's a way to get the goods out to the people.
Well, and so many people have, you know, felt the need to donate so much more lately than you used to hear about. But I'm curious about some of the programs that Catholic Charities oversees. Some of the things like preventing homelessness or serving veterans. What are some of the ways that Catholic Charities reaches out to those types of individuals?
Sure, and we have several different grant programs and contracts that we help provide services not only to people here in Southeast Missouri, but across all of Southern Missouri. So some of those programs are homeless prevention programs, or working with the homeless directly. We have a program through the Veterans Administration to help house homeless veterans. So literally taking veterans off the street, assisting them, getting them into stable housing. But more importantly than any of that is working towards sustainability. Okay, so just as the Bible kind of tells us, you know, you can give somebody a fish and you've given them a meal. You teach somebody how to fish and you give them a life. And that's really what our programs are designed to do, is really give people their lives back, not merely handing out charity. There's very, very little, as we say, quote, charity given out. It's generally programs meant to make people self-sustaining. So all of our programs, whether it's homeless prevention, we enroll them in case management services to help assist them in becoming sustainable. We have a program called Healthy Moms, Healthy Babies, where we take at-risk pregnant women. And one of the most fascinating statistics, Audra, is our program. We just wrapped up grant year this past year. For every woman that stayed in the program, which is about 70, we had 70 healthy babies born, okay? Which means that those babies aren't born addicted to drugs, they're not born addicted to alcohol, which means they're not born in neonatal units, which absorbs a lot of our tax money. It's estimated that up to $100,000 for a child born in neonatal unit sucks away our tax money.
Well, and that's the hot button for people right now. And so Catholic Charities is working on not only helping people, but finding better ways to do it.
Oh, absolutely.
Well, Kyle,
and 80% of our individuals, when we discharge them, had a job or were in school for full time.
well, we could talk about this for an hour, and I'm sure you have so much more information, but I'm so grateful that you stopped by today, because I know that there's somebody out there who's hearing this and is going to be helped. Thanks
Absolutely.
for coming by.
Thank
We've
you.
been talking with Catholic Charities of Southern Missouri Regional Director Kyle Schott. On the way next, the new director of the Community Caring Council. Stay tuned for more of Cape Chronicle.
We don't see problems. We see opportunities for creative solutions. At Southeast Missouri State, we don't think outside the box. We got rid of the box. We embrace innovation and turn ideas into successful businesses by learning from those who've been there before. We even offer a safe space to try out ideas before launching. Who else can say that? Entrepreneurship is everywhere. Let's make your ideas happen.
The following is a public service announcement test to determine if you need a fishing license and boat registration before you head out on the water. Let us begin. Are you your own boat? Is this your idea of fishing with friends? Do you want this in your favorite lake? It. Regardless how you answered, you need to be licensed and registered. Do your part at takemefishing.org.
There's more to history than books. At Southeast Missouri State, we're getting our hands dirty and preserving history. Our classrooms are museums, homes, and historic sites. Because the past can teach us so much more when it can be touched. We're preparing for the future. Because to know where you're going, you must know where you've been.
Welcome back to Cape Chronicle. Residents of our area have a number of organizations to assist them during a time of need, but there is also a need to coordinate between those providing services and those receiving them. The Community Caring Council has a new director, Melissa Stickel, and she's here to not only introduce herself, but also explain how the council works for you. Welcome, Melissa.
Thank you.
It's so good to have you here today. So now you're new to the job. There's probably a few things you're processing, but for anyone who doesn't know what the Community Caring Council is, what is the goal of the council?
So the real spirit behind what the council does is exactly what you said a moment ago, that coordination, that collaboration, really supporting communities and organizations in helping families and individuals basically achieve self-sufficiency. So a lot of times that's identifying needs, identifying areas where the community can come together. Really, that collaboration piece is really the essence of what we do.
Okay, so tell us about just some of the programs that you work with.
Sure. So we do some direct client services, especially around housing. That's a huge piece of what we do. We get some grant funding from HUD and the state in order to do that, emergency solutions grant, just like some other agencies in town. But outside of that, we provide some high-level coordination like our oral health coalition, our aging committees, our parent and education committees that bring together parenting and education programs and making sure there's not duplication and that there's coverage. We have some youth programs like Missouri Mentoring Partnership, our Thrive 40 Developmental Assets program. We really have a wide spectrum of services, programs, priority issues there at the council.
I'm curious, you mentioned youth programs and then you also mentioned some parenting of young children. Is that something that you all coordinate, like identifying those individuals who need it with the public school system? Or how are they identified?
Sure. So it depends on the program. Particularly for that parenting and education piece, we actually partner with the Children's Division, and we receive a lot of referrals that are actually mandated to participate in those because they've lost their children for some reason or need to go through a parenting class in order to get custody back of their kids. We also partner with Division of Youth Services with kids that are in places like the Girardeau Center or ECHO, providing some mentoring to them. And then we also do some programs in the schools.
Okay, so serving as a liaison organization, what are some of the pitfalls or barriers that the Community Council or Community Caring Council runs into with programs?
Sure. Probably the most significant barrier is just the perception that something doesn't exist in this community, that there's not a problem with poverty, that there's not a problem with homelessness, or we don't have a problem with this or that. But the reality is that we do. And so the biggest barrier is educating the public, the community, that there is an issue and we need to come together to respond to that.
Do you also find it a little bit of a barrier sometimes that those who really need to receive the services don't know about it?
I'd say yes, to some extent, but largely there's this huge word of mouth network among individuals who are in similar positions. So we have, 2,000 people walk through our door in a year asking for some sort of assistance. So I think for the most part, we've been around long enough that they know that we have services available. You
mentioned Facebook, and I know that that is an extremely popular way for people, like you said, word of mouth and get information. Is that one way that you communicate with the public?
Yes, absolutely. We do have a Facebook page. Love for the public to go on there and follow us. It runs the gamut of the things that we do. Very informational.
Okay. Speaking of information, I said that you're new to the position as director of the Community Caring Council. How did you come about working with this organization?
Well, I definitely am humbled that the board of directors of Community Caring Council selected me for this position. And as much as I can sit here and say my education, my experience, all that has led up to this and prepared me, it's really more importantly, or more pertinent, is the relationships that I've built in this community through the things that I've done, through places I've worked, through organizations that I've been involved in on a volunteer basis. And it's been those relationships that have made me recognized as the right person for the position.
What is it about the position that you feel the most passionate about?
I am so passionate about helping people that don't have a voice. People who are underrepresented. I grew up in poverty myself, and so a lot of people have a hard time overcoming that, despite the stories that you hear of people becoming millionaires or something after living in poverty. Generally, most people don't. And so just the fact that I can sit here in the position I'm at, I have so much respect for someone who's struggling, and that's where my passion is.
Well, you're definitely a great example of someone who, it doesn't matter where you've come from or what you've been through, you can not only receive services, but you can also find a way to help others. And I know that there are a multitude of ways that people can help the Community Caring Council reach people in this community, and so encouraging them to contact you is probably the best thing we can do today. Well, thank you, Melissa. It's so nice to meet you. So glad that you've taken over and that you are leading by example.
Thank you.
We've been talking with Community Caring Council's new director, Melissa Stickel. On the way, we will hear from Cape Girardeau County Public Health Center Director Jane Wernsman and health educator Liz House to review contagious and chronic diseases and more. That's next on Cape Chronicle.
At Southeast Missouri State, we know agriculture can mean so much more than working on the farm. It means research and lab work that lead to profitability and sustainability. It means creating new jobs that other people haven't even thought of yet. It means the spirit of entrepreneurship and the desire to make your own way. You want to do something groundbreaking beyond plowing fields. So let's get started.
I just walked by and I said, "What's happening, guys?" And they told me they were making music.
It's the way you walk, it's the way you talk. I like this music.
They said I could play, so any chance to play at all. That's my life. I love music.
Yeah, that's how we do it.
Through the years, trends and styles may come and go, but the important things remain the same. Generation after generation, consistently there, creating moments and memories to last a lifetime. Like a true friend, the national parks have always been there for you, and now you can be there for them. Support the National Park Foundation and help protect America's treasured places.
This is Cape Chronicle, and I'm Audra Kane. If you have ever had a child with a high fever or your own unexplained illness, you may have wondered if it's something more serious. Jane Wernsman, the director of the Cape Girardeau County Public Health Center, and health educator Liz House are well versed in contagious and chronic illnesses, how to recognize them, and how to manage them. So welcome, Jane and Liz. All right, so we have to start off with the hot button words, the mumps, and the Zika virus. And those have both been coming up in the news a lot lately. So tell us, do we actually have issues with that in our area?
We do have a larger number of mumps cases in our county than we have in the last several years. But in fact, it's kind of been spotty nationwide for the last few years. Just in comparison, though, if you look at several years ago, and I'm talking maybe 30 years ago, the number of mumps cases was up to here, and we're down here now nationwide, mainly because of the vaccines that we're able to give, the measles, mumps, rubella injection. But we have seen a resurgence across the country, especially in groups that are in close proximity, congregating, living together, such as college campuses.
Absolutely, yes. I have two on college campuses, so I know how that goes. Well, Liz, how do you educate people about making sure that they are vaccinated for things like the mumps?
So we always push, of course, for vaccination. It's one of the biggest public health things that we do. The measles, mumps, rubella shot, typically child gets them before on their first birthday and then again before kindergarten. So whether it's that vaccination or others, we always just try to educate the public on what's recommended, when, why, answer, any concerns or questions they may have.
And I don't want to open a door that we don't want to go through, but I know that a lot of people are not vaccinating their children over certain types of discrepancies, and whether it's truth or manufactured information, it's still really safe to have your child vaccinated for something as simple as the mumps, right?
It is, and again, if you look at those statistics from 30, 40 years ago when we were having a really high number of cases and even deaths from vaccine preventable diseases compared to what we're seeing today, it makes sense in relation to the side effects that could possibly be there from a vaccine.
What's the first symptom of a mumps infection?
Well, mumps, like so many other of our communicable diseases, it could have an onset similar to the flu, achy, tired, but then the fever starts, the really bad feeling of being tired, the malaise, and of course the classic sign of the swelling of the underneath the parotid glands underneath here. That is your first clue that it's something a little more serious than just the flu or another type of virus. Right, and that swelling is really kind of the key there. And is that what makes it so dangerous? The swelling? Mm-hmm. Well, that, and it can lead into, if the fever gets higher, an individual can be more compromised and perhaps develop more serious complications from that. Okay. Well, and the other thing that I'm curious about in this, again, is another hot button issue, is the Zika virus, and whether of course, it's in southeast Missouri, and so of course we have mosquitoes almost all year long sometimes, but do we actually have any evidence of Zika in our region? We have not had any positive cases of Zika infection reported to us at the health center. We have had several individuals who might have been tested because they had symptoms similar to the onset of a Zika infection, but we've not had any positive test results from that. To my knowledge, the mosquitoes that are actually carrying the virus have not been identified in our area. And of those individuals that might have been tested from the county, they had association with foreign travel.
Okay, so definitely with foreign travel, not just something, you know, they went to the coast or something like that.
It was actual foreign travel.
Okay, and if, and I mentioned symptoms again, if there's a symptom that is indicative of Zika, it could be confused for something else too, right?
You know, and that's why it's so important is when you start to feeling bad, and you know, the best thing to do is to check those things out with your private primary care doctor, your clinic that you're used to going to, and let them evaluate you and try to rule out some other things first.
Liz, some of the parts of, and we've just got a couple more minutes, some of the parts of identifying infectious diseases and things like that are about educating the public. And where do you go to in order to help educate the public?
So I always fall back on, as a lot of us at the health center do, is, you know, using the Missouri Department of Health and Senior Services and their information and resources, the CDC website. They have all kinds of information. It's very informational, thorough, and so we always fall back on those to kind of build whatever resources we may have.
And how do you share that with the public normally? We
typically share that through the public with whether they're coming in our offices or through our social media or even our website. Those are some of the main ways we communicate those messages to the public.
Okay. And if you had anything that you would say to people about managing disease or identifying things and they wanted to reach you, it's really simple to find you, right?
Well, we think so, but we don't, you know, we know where we are, but we like to think that we're getting the information out there through our Facebook and other social media programs such as this, community programs that we're doing, our web page, and of course there's always the phone.
And exactly, people can always call you anytime, right? All right, well, thank you ladies so much for coming in. We've been talking today with Jane Wernsman and Liz House of the Cape Girardeau Public Health Center. We'd like to thank all of our guests today and thank you for joining us for Cape Chronicle. Our program is a collaboration between the Department of Mass Media at Southeast Missouri State University and the City of Cape Girardeau. Our executive producer is Dr. Jim Dufek. I'm Audra Kane. Thanks for watching.